Hello and welcome to Family Dentistry of Frisco, Laser, Sedation and Implant Center. My name is Paresh B. Patel and I am the principal dentist and founder of Family Dentistry of Frisco. I have had over a decade of experience in general dentistry and I wanted to share some of my cases and some information to reflect my enthusiasm and passion for the art and science of dentistry. We are a state-of-the-art facility in the heart of Frisco, Texas. We pride ourselves on having a particularly distinct facility with great facilities and, more importantly, great people and a great environment to help serve our patients to the best of our abilities. We welcome you all to come and visit our website www.fdfrisco.com and make an appointment to come and see us to see if we can help enhance, rejuvenate and maintain your beautiful smiles. The subject for today's video log is, what is a dental crown? Let's start with a few indications for a dental crown. Loss of a significant proportion of tooth structure, which could be because of decay. It could be because the tooth had to be root canal filled and a hole had to be made into the tooth, and that weakens the tooth sometimes. It could be because the tooth broke for various reasons, such as a fracture, a crack, abrasion, erosion, which are ways that a tooth can be worn down. A crown could be needed because of cosmetic recontouring, because the tooth was misshaped or because the patient wanted the teeth to be more uniformly shaped. It could also be to modify the shape of a tooth in order to allow one to support or wear a denture or a bridge of some sort to replace a tooth. In today's case, we'll be seeing a maxillary, which is an upper first molar tooth which was decayed and had a large metal filling in it for over 18 years, and the patient had understandably been reluctant to get anything done about this tooth. Cracks had developed, there was secondary decay there, and after much thought and the patient came to see us, we showed the patient the cracks and the decay in the tooth, and he decided to have the crown placed. The crown, or a dental crown rather, can be made of many materials. At our office, we predominantly place all ceramic restorations. I personally believe that all ceramic or white crowns with no metal backing have come a long way in dentistry, and these crowns now represent a restoration which can be used for most situations that require a dental crown, offering an effective and cosmetically pleasing result. Here is a diagram of how a crown looks. The crown essentially braces the tooth together and helps to keep the tooth in place and intact, and to transmit the force back down the root in the direction of the root, as opposed to having a large filling or a crack which may direct forces in many directions and cause the tooth to crack and split, and therefore reduce the lifespan of the tooth. Here we see a picture of the tooth in question having had the old amalgam restoration or the silver filling removed. You can see some cracking, you can also see some secondary decay and the lining material which existed beneath the metal filling. Here is another view of the tooth with the decay and lining material visible. You can also see the cracks in the tooth. Once the decay was removed, a composite core was placed into the tooth. You can still see some shadowing under this core, but that is not decay. If a metal filling has been in the tooth for many years, sometimes corrosion or rust products can get into the tooth mineral and appear to be decay. But once all the soft and decayed tissue is removed, if there is a hard base of tooth which has been stained, this need not be removed because it may not be decay. Once the tooth is prepared for a crown, the tissues around the tooth are retracted. Essentially, a small thread-like material is pushed beneath the gum in the tooth so that the margin where the crown will fit to the tooth is able to be visualized circumferentially around the tooth, and this allows the impression material to flow down beneath the tooth and the gum, and a good representation of this area to be imprinted into the impression material. Here you see the impression with the cord which has been pulled away in the impression, and you can see on the inner aspect of the cord that a nice distinct impression of the tooth, a negative impression of the tooth, has been formed into this impression material. Here is a provisional or temporary restoration that was made and placed on the tooth. This will be worn by the patient until the crown is ready to be seated on the patient's tooth. Here is a picture of the stone model. If you imagine the impression that was shown earlier in this presentation, a very strong dye stone is poured into that, and this model is created in a laboratory upon which the crown is constructed. Here is a picture of the crown the day of seating. As you can see, it has a very natural appearance and conforms and harmonizes very well with the adjacent teeth. This is a picture of the crown a week after it was seated, and you can see the tissues around the tooth, and especially where the crown meets the gum, are particularly healthy and in conformity with the adjacent teeth. All in all, a very pleasant result, I think you'd agree. Thank you again for listening to this presentation. Feel free to visit our website www.fdfrisco.com. Feel free to come and visit myself and my staff at Family Dentistry of Frisco, Laser, Sedation and Implant Center, where your smile is our passion.